Wednesday morning. The American Cancer Society says breast cancer is the most common cancer among women in the U.S. after skin cancer. But there's a lot of misinformation about the disease.
Joining us this morning to clear up some of the myths, Dr. Jag from the Cancer Treatment Centers of America. Thanks so much for being with us.
Thank you.
First off, talk about some of the misconceptions that are out there that people have that they don't need to maybe worry about as much as you might think.
Well, one myth is that if you don't get your mammogram and so on, if you just do a self-exam, that you will be able to find all the cancer. The truth is, you need to do your self-exam in addition to your mammogram, because self-exam can only find about 25% of cancers. Now, if you do self-exam and a mammogram, you can pick up about 40% of breast cancers.
And what is your recommendation for the baseline mammogram? What age do we need to start that?
If you have a high-risk category, if you have a BRCA1 or BRCA2 mutation, they need to be starting around early as possible, 10 years before the first diagnosis in your family. If you are a woman, and I recommend that they start at the age 40 because it's very important for them to start getting screening earlier.
And of course, some of the myths out there, like birth control pills, cause breast cancer. A lot of people think that may be the case. Is that true?
Absolutely not. The largest study to date has been done in the UK. 50,000 women followed over 24 years, and the incidence of breast cancer was not increased at all. However, the risk of the increase in cervical cancer and brain cancer was increased, but colon cancer, ovarian cancer, and uterine cancer was decreased as well. So very mixed study right now. We don't really know what it means, but for most women, it's okay to take the pill.
Okay, I have seen a rumor out there linking deodorants with antiperspirant to breast cancer, certain chemicals like aluminum in it or parabens. Is it true? Does deodorant, antiperspirant, can that cause breast cancer?
No, absolutely not. In fact, I have an image here of a sweat gland. And what you can see here is that the lymph nodes itself are not even connected to the sweat gland itself. So here is a sweat duct, and the sweat gland goes to a sweat duct on the skin, and the lymph nodes are far separated from this. So there is no connection. So women, please, you can shave and you can wear antiperspirant.
Okay, all right. Well, those are definitely good things to note. And again, you say 40 is the appropriate age for most women to start getting the mammogram. Don't forget to do the monthly self-exams.
Absolutely.
You guys have a new treatment option as well for breast cancer. Tell us about this.
Well, we're excited to introduce intraoperative radiation therapy, which is new to Oklahoma and to our facilities as well. So what this allows you to do is to be able to deliver radiation during surgery. What this does is eliminate the 5 to 6 week time period for radiation therapy after a tumor has been removed from a breast cancer.
Wow, that's huge. So many patients report feeling fatigue during radiation. Does this give you like a super dose of it? Or
it does.
Okay,
it gives a much higher dose.
So then recovery from your surgery, is that slower?
It's actually, your recovery from surgery is just it's the same recovery time. You won't have actually the same amount of complications as you would with radiation therapy that you would typically have from the sequential radiation therapy normally given. I
guess it makes sense if you've already got the skin opened and you're delivering it, because a lot of people have the redness or burning of the skin from radiation.
It is. It provides a much greater cosmesis. That is, the area is shielded, it's protected, and that way the delivery of the radiation is reduced from 5 to 6 weeks down to 5 minutes.
Wow.
Terrific.
That's huge.
Wow.
Thanks,
Thank you.
Dr. Jag.
We appreciate you coming on. Great information. And of course, this morning, Cancer Treatment Centers of America has a special offer for all Fox 23 viewers. They're giving away free subscriptions to their quarterly magazine, Cancer Fighters Thrive. If you'd like to sign up, we have put a link on our website. Just head over to fox23.com and click on the Fox box.